So let's start with question 1. How old are you?
Yeah, so as you're going through this test, what you're gonna do is you're just gonna key in and give yourself the different points based on the certain risk factors, right? So depending on your age, as you increase in age, your organs age. So obviously as you're getting older, you're not functioning at 100% capacity, and that increases your risk for developing diabetes.
Okay. Question 2 and 3.
Again, if you are a man or a woman, you can see how to score there accordingly. And again, if you've had gestational diabetes, you would score that as well.
Okay. Thankfully, even this one, I have 2 zeros, right?
Yeah, you're...
Okay.
Again, but this sets the tone for you to be able to see and again follow through where maybe you haven't been to the doctor in a while. Risk factors within the family, if you have an immediate family member with diabetes, that would score you 1 point, no for 0 points.
Well, how about if they had diabetes? They don't have it, or it's managed? Is that how we...
They would still have been diagnosed, and that would be a positive.
Okay. Okay. And now the last one, are you... Yes.
Are you physically active? And then on the other one, there was the blood pressure question. So if you ever had been diagnosed with blood pressure, it's a 1 for yes and 0 for no. And then we're gonna go into the weight category. And again, obviously this sets, you know, an increased risk factor based on your height and then based on your weight. So you would just scroll across from where your height is to your weight. And if it's not on that, then that would be 0 points. But again, if you are a woman of 5'2", or we're on 5'8" right now, and you're 175, then you scored 1 point, right? So again, it's just scrolling over to see where you fit at.
Now, back to the blood pressure. So if it was like a one-time blood pressure, high blood pressure, maybe because it was incident.
No, one time, no. Diagnosis of it, continuous, kind of perpetual high elevations, yes, it's a score of 1.
Well, then my score is 1.
You don't have the increased risk for diabetes. And again, that's the paper test that we can do with people just really quick in the moment. You're at home, you're doing it right now as you're watching the TV show, to be able to then say, do I need to go make an appointment with my doctor? And the one thing I would say is, obviously if you have, because what I heard you say is possibly a family member that has it, that sets up an increased risk as well. And so even though sometimes the normal test is to do a fasting plasma, for you I would encourage an A1C done. Why? Because you have it already within the family, and that just allows for you to now have a better indication of where your blood sugars have been.